Conventional transvenous pacemakers require leads and a subcutaneous pocket. Lead-related complications include fracture, infection, and venous obstruction. Pocket-related complications include hematoma and infection. There are limited options for patients with poor venous access or high infection risk. Lead traversal through the venous system and generator placement introduce multiple long-term failure points. Atrioventricular synchrony is required to maintain cardiac efficiency. Loss of atrioventricular synchrony is associated with reduced cardiac output. Bradyarrhythmias, requiring permanent pacing therapy, include disorders in impulse generation and impulse conduction, such as sinus node dysfunction, also known as SIC, sinus syndrome, and atrioventricular blocks. Increased morbidity occurs in patients unsuitable for traditional dual-chamber systems. Transvenous leads are subject to mechanical stress and long-term failure. A subcutaneous generator pocket increases infection risk. Venous anatomy may limit safe lead placement. Traditional leadless pacemakers lack atrioventricular synchrony. Lead extraction and revision procedures further increase procedural complexity and risk. The Medtronic AV2 is a fully self-contained, leadless pacemaker implanted directly in the right ventricle, designed to provide ventricular pacing with atrioventricular synchrony. Delivered via a catheter-based femoral venous approach, the device integrates pacing, sensing, and fixation into a single intracardiac system. The device senses mechanical atrial activity using an internal accelerometer and interprets atrial contraction signals, and timed ventricular pacing maintains atrioventricular synchrony. The device features a miniaturized titanium housing, natanol fixation tines, and an internal battery. It has a mass of 1.75 grams, a volume of 0.8 cubic centimeters, and a median projected battery longevity of 15.6 years. The system is MRI compatible up to 3 Tesla. The procedural workflow involves femoral venous access, catheter advancement, positioning in the right ventricle, device fixation, and confirmation of electrical parameters before delivery system removal. Clinical studies show high rates of atrioventricular synchrony and lower major complication rates compared to transvenous pacemakers, with 0 infections requiring device removal at 5 years. Potential risks like cardiac perforation are mitigated by controlled deployment and real-time fluoroscopic guidance. The system eliminates transvenous leads and subcutaneous pockets, providing minimally invasive atrioventricular synchronous pacing for selected patients.